We all have to take care of our mental health, just like our physical health. It's not only about mental illness or disorders, that's just one piece of the puzzle. Picture mental health like a continuum instead, where we all fall somewhere in between being mentally ill or mentally well. We're all riding that continuum, going up and down depending on things like our genes, how we were raised, what's happening in our lives, and the pressures we face. On one side of the continuum, you have mental disorders like depression or anxiety, and on the other side, you have those moments of positive mental health when we're thriving, feeling content and fulfilled. The goal of mental health interventions is to move people up the continuum, help them reach their full potential and live fulfilling lives. According to the World Health Organization, mental health is all about having a sense of well-being. It's when every individual recognizes their own potential, can handle the normal stresses of life, be productive and fruitful, and make a contribution to their community. Being mentally healthy means being strong and able to handle tough times, feeling in control, having confidence, liking yourself, managing and expressing your emotions, and building solid relationships. We all go through times when we feel stressed, worried, anxious, sad, scared, or mad. There's nothing wrong with that, because those are normal emotions. But when they get really intense and start interfering with our daily functioning or stick around for a long time, that's when it can turn into a mental health issue. There are all sorts of mental disorders out there. If left untreated, they can become chronic and stick around for the long haul. They mess with our ability to function every day, mess with our family, social life, and work responsibilities. Thankfully, there are effective treatments and evidence-based interventions available. The goal is to help people understand and deal with symptoms of mental illness. Unfortunately, only a small number of people with mental disorders actually get the help they need. There are all kinds of barriers standing in the way, like the shame associated with seeking help, the lack of knowledge about mental health issues, not knowing how to get help, or just being afraid to talk about their mental health problems. Research tells us that stigma is one of the biggest reasons why people don't seek help early on for their mental health problems and don't get the support they need. We have to recognize that we all have mental health, and it's our personal responsibility to learn how to improve and maintain our well-being so we can lead meaningful and satisfying lives.